Hello, my name is Simon Bott. I'm a consultant urologist working in Surrey and Hampshire, and I've had a lifelong interest in prostate cancer. Prostate cancer is the most common male cancer, affecting between 1 in 6 and 1 in 8 men. It's the biggest male cancer killer, so it's a really important disease. Most men will develop prostate cancer and never know they have it. They will live a normal, full, healthy life, oblivious to what's going on in their prostate. My job is to identify men who might have prostate cancer that's going to affect them in their lifetime. So I do that by talking to the patient, arranging appropriate blood tests, and then doing a multiparametric MRI scan on the latest MRI machine, a 3D scanner, looking at various different issues within the prostate, particularly the anatomy, the blood flow, and the amount of water. And that is a very accurate way of saying whether or not there is significant prostate cancer in that prostate. Further imaging can then be undertaken with things like PSMA PET scans, which I can also organise. I was the first person in the country to describe a transperineal prostate biopsy. This involves taking biopsies through the skin rather than through the back passage, which is much safer for the patient as it reduces the risk of infection. I was also the first person in the country to use the Trinity Coelis fusion biopsy system. This allows much more accurate targeted biopsy, ensuring that when I do the biopsy, I hit the area of interest. This means I take fewer biopsy calls, which means it's less uncomfortable for the patient, but also less risky in terms of infection and bleeding complications. I diagnose prostate cancer, but I don't treat it myself. This enables me to be impartial when I advise about treatments. So I can advise you about all the latest treatment options and where best to get these treatments in an impartial, objective manner. I will take into account your concerns and any symptoms you may have to best decide what treatment you may have. I'm currently also investigating ways to use AI to interpret MRI scans and speed up and make more accurate the diagnostic pathway, and also using AI to interpret biopsy results, which give more information than perhaps a pathologist might give without the assistance of AI.